morning, folks, and thank you for joining us on this fine afternoon on News Channel 8. Today we will talk about medical robots. They've helped education and now surgery. Now I'll introduce Ms. Getzel, our technology specialist who will talk about the DaVinci robot, a surgery-performing robot.
Thanks, Ms. Kenzel. I am happy to be here to answer all of your questions.
Happy to have you. Well, my first question is, how does this robot work?
DaVinci performs robotic surgery. This means that it performs surgery on a person. The robot is controlled by the doctor in this console. The console has 3D HD vision. Instead, the patient cart is where the actual surgery is performed. It has 4 arms, 3 of which perform the actual surgery, and 1 of which it keeps the organ or thing that is being operated in place.
Fascinating. Now, how is this robot going to save the doctors and, more importantly, the patients money?
This robot is less expensive to the patient because he or she can stay half the time in the hospital for recovery than they would with a human maneuvered surgery. Therefore, less money has to be extracted from their insurance.
Now, why would people prefer robotic surgery to normal human maneuvered surgery?
This is a question that so many people ask. Now, this robot is so precise with so many different actions that instead of opening your abdomen to get to your heart, it can just do small incisions if it would be a heart surgery. As I said before, this leads to less recovery time and smaller to none scars after surgery.
Wow. Now, my last question is, what makes this robot so special?
As you can see here, the DaVinci is so precise that it can
paint a fingernail.
The DaVinci also has 3D HD vision that can really help the doctor perform surgery that other robots don't have.
Well, thank you for being here to answer all
No
of our
problem.
questions. Now, to wrap things up, I will go to Chris at the Christian Hospital, who will tell us a little more in depth about the DaVinci. Let's take a look.
What we have here is 3 components. Where Dr. Monkler's setting is what we call our surgeon console. It's where they actually do the operation. This is what we call our patient cart, or some people refer to this as the robot. This is the operative component of the system, which we kind of call our arms and hands of the system. Where Dr. Monkler's setting, we call it the brains of the system. This is what we call the eyes of the system right here. This is our vision tower, and our instrumentation works to where the doctor is in 100% control.
Once I put my head in, it senses, okay, the surgeon is looking at the camera and can control the instruments. So, this one is to focus the camera. This one is to allow my hand to move the camera. It does take longer than open surgery, there's no question about that. As with everything else, the more you do it, the faster it becomes. But the benefit is obviously less pain for the patients, shorter stay in the hospital, faster recovery. It's really quite amazing, the technology that goes in that and all the safety mechanisms. You have to have surgical training, a tool to allow us to operate through small holes. So when you're trying, let's say, to resect cancer of the lung or cancer of the uterus and you're in the pelvis, and you're trying to do it through a tiny incision, you lose a couple of things. One is your vision is gone, so you can't really see through a tiny hole. You have to put a camera in. And the camera here is a 3-dimensional camera, so I get depth perception very well, versus just like a TV screen.
I mean, when you're looking in there, you see 3D. You don't
Right.
see what we see. You
Yeah.
see 3D.
So I'm seeing 3-dimensional things. I can tell depth of my instrument and such. So then the other advantage to the system is, again, through a small incision, we only have so much room to place instruments.
Okay, thanks folks for watching News Channel 8. You saw it here, the DaVinci robot can peel grape, fold origami, and even perform phenomenal surgery. Well, thanks for watching and join us tomorrow afternoon on News Channel 8.